Hi, and welcome back to Medicinal Herbs Discovered. Today we will be discussing ginger. Ginger's official herbal name is Zingiber officinale. Now, let's take a look at the actual ginger plant. The ginger plant grows up to 3 feet tall with narrow leaf blades. Its flowers have pale yellow petals with purple edges. The ginger plant also grows pseudostems, which are false stems made of rolled bases of leaves. Ginger roots can grow to be 4 to 5 inches long and are slightly jointed. These roots are also called rhizomes. So, what part of the plant do we use for medicine? The root, or rhizome of the plant, is where ginger holds most of its medicinal value. Most of ginger's constituents are held in the root. The main medicinal constituents are the bioactive compounds gingerol and shogal. Ginger also contains many antioxidants. We will discuss these constituents in depth in the recommended use sections of this video. Now, let's take a look at the action and energetics of ginger. Ginger is a pungent and warming stimulant. It has a very strong smell. In Ayurvedic medicine, ginger is known to increase kapha. Ginger's number one use is for nausea and vomiting. This is due to the gingerols and shogals that block the neurotransmitters in the body. These neurotransmitters are acetylcholine and serotonin. These neurotransmitters are responsible for the nausea and vomiting that some people experience. So who can benefit from this first use? Those with morning sickness, the flu, and some patients affected by cancer treatment-induced nausea. A second common use for ginger is its ability to stimulate digestion. Ginger accomplishes this through an increase in pancreatic lipase. This breaks down gaseous compounds and cholesterol in the body. So who will this help? Those with high cholesterol and those experiencing flatulence and constipation, and in those individuals who seek to lose body weight or decrease their waist to hip ratio. This is because ginger decreases bloating. Ginger also has anti-inflammatory and pain-relieving properties. This is also due to the gingerols and shogals' phytochemical properties. These constituents inhibit prostaglandin and leukotriene production, the hormone mediators responsible for inflammation and pain. The patients who benefit most from this use of ginger are those with osteoarthritis and premenstrual syndrome pain. Another group of people who also benefit from this anti-inflammatory property are those predisposed to Alzheimer's disease. They have found in some studies that ginger can help prevent some of the chronic inflammation in the brain that can lead to this degenerative disease. So where does ginger grow? In hot, humid locations. Ginger is typically found in grow zones 9 through 12. Ginger can be harvested 10 to 12 months after sprouting, when leaves turn yellow and stems fall over. To harvest earlier, trim the tops of the plants 2 to 3 weeks prior to desired harvest date. So what about preservation of ginger? Well, we can freeze it, we can dry it, we can pickle it, or we can candy it. These preservation methods help to preserve the constituents present in the ginger root to be used medicinally at a later date. Ginger is considered an extremely safe herb. Although in doses higher than 5 grams per day, ginger can produce side effects such as heartburn, mouth and throat irritation, and diarrhea. There are no medical contraindications for ginger. However, ginger is incompatible with certain medications. ginger can interact with blood thinners when taken in high doses. This is because ginger has anticoagulant effects similar to those found in commercial blood thinners. Patients should also use caution when taking ginger with diabetes medications. Ginger has the ability to lower blood sugar in high doses. This effect augments the decrease provided by diabetes medications and can produce an unwanted effect of low blood sugar. Due to ginger's increased pancreatic enzyme activity, ginger should not be taken in medicinal doses with metronidazole or cyclosporin, since these enzyme activities can lead to higher blood concentrations than desired. So let's look at some of the medicinal preparations of ginger. These include ginger tea, which can be made by boiling the ginger root in hot water. This tea can be used up to 4 times per day. Pickled ginger is very common in Asian cuisine. It can be eaten with meals to help dietary intake of ginger. The most potent form of ginger preparation is dried ginger, which is often found in the form of candy. This has the highest gingerol content and can be taken in doses of 250 to 1,000 milligrams 1 to 4 times per day. So, who was medicinal ginger for? Adults? Yes. Children? Yes, but in smaller doses. Pregnant women? Yes. Breastfeeding mothers? Yes. But remember, always ask your doctor before starting any new medication or supplement. Thanks for watching. Please consider subscribing to Medicinal Herbs Discovered. We post new top 5 videos every week, as well as a new herb of the week every Friday afternoon. Thanks, and happy watching!